Schumer and the Democrats have said they support. In fact, just as recently as last year about this time, he made the statement that shutdowns cause pain and needless harm and chaos for the American people. That was his exact quote about this time last year when we were considering a CR. Now, interestingly enough, during the Biden presidency, when Schumer was the leader, the majority leader, there were 13 short-term CRs. 13. 96% of all Democrats voted for all 13 of those short-term CRs. So we're suggesting right now a short-term CR to get us to November the 21st, to give us time to process and consider appropriation bills, which is the way we ought to be funding the government. And it's going to take 60 votes to do that here in the United States Senate. So I'm hoping that, notwithstanding what Senator Schumer is saying, that there are Democrats out there who think it's a really bad idea, like they did last year, to shut down the government. And if, in fact, that's the case, hopefully they will deliver the votes that are necessary for us to keep the government open, keep the lights on, and we are going to give them an opportunity to do just that. As you know, the House has posted their legislation. They will send it to us later this week, and we'll have an opportunity to consider it and process it over here. But it's really important, from our point of view, that we pass, both the House and the Senate and the President sign, a continuing resolution to fund the government until November the 21st to give us an opportunity to do appropriations bills. Now, again, remember, that's not something that they're accustomed to doing. When Democrats had the majority around here and Chuck Schumer was running the Senate, we didn't do appropriation bills. Just didn't do them. They rolled them back there in his office. We've tried a different business model, which is to allow senators on both sides of the aisle and their committees, in this case the Appropriations Committee, to pass legislation with an amendment process, report it out to the floor, hopefully with an amendment process to enable all senators to have their voices heard on these important issues of funding our federal government. So that's where things stand today. And again, I'm hopeful that they'll come to their senses and there'll be enough Democrats out there who consider Senator Schumer's advice, which I think he's getting from online trolls and activist groups, which he shouldn't be listening to, that they'll conclude that that's really bad advice and work with us to keep the government open. So at our lunch today, we had Dr. Oz was here to talk with our colleagues about the things that the administration is doing to revitalize and make sure that our rural hospitals are alive and well and delivering the services that many in rural America expect and them to deliver. And so I'm going to allow him to make some comments about the things that they're doing at CMS, and then we'll open it up to your questions. Dr. Oz. There you are. Okay, sorry.
The Rural Health Transformation Fund is basically a space shot that will allow us to completely re-envision how rural health care is offered in this country. And to put it in perspective, about 7% of Medicaid dollars go to rural health care. That's about $19 billion a year. This fund is $10 billion a year for 5 years. So a 50% increase in the amount of money that Medicaid will pay into rural health care, because this Congress and this President wisely figured out a way to put money into the system and stimulate and catalyze transformation of the way we offer care in rural America. Now, why? What's the crisis? And it's a crisis. Rural America has a 3-year shorter life expectancy than urban America. 20% higher incidence of chronic diseases that lead to cancer, heart disease, hypertension, obesity. 50% increase in suicide rates and maternal mortality. I mean, significant and dramatic increases in risk factors based on the zip code that you live in. And your dignity should not be tied to your zip code, nor your mortality rate, nor your life expectancy. But that's what we're facing. Part of the problem is that rural health care financially is in dire straits, with 40% of the hospitals reporting financial crises, and but most of them reporting a census that's half that of urban hospitals. So Congress wisely decided the best way to do this was to take a large sum of money, $50 billion over the course of 5 years, divide it in half. Half is distributed equally to all 50 states. The other half, based on applications, which went out yesterday, that need to be returned by November 5th, will be a competition, a race, to see which states have the most innovative ideas, the cleverest ways of improving health care, of right-sizing their health care system, of doing better workforce enlargement and training, letting people function at the height of their credentialing, using innovative approaches like hub-and-spoke models with big urban hospitals, maybe helping smaller rural hospitals stay afloat, provide better quality care. Many senators have shared with me that they know of hospitals in their state that are originally 100-bed hospitals that shrunk to 10-bed hospitals but have a census of 1, where people in the town are driving past that hospital. We need to either improve the quality of the hospitals or right-size the systems in other ways. We have 85,000 pharmacies, 5,500 hospitals, by the way, but we have so many more pharmacies. There are many of them in rural America. They need to be able to function at a higher level. All this is out there for states to respond. Congress thoughtfully put the money at CMS to give to the governors, which is what we're going to do by the end of this year. The governors will then have each of them the next year to do the best they can with what they applied for and use that money wisely. Every year will be reassessed, and money that's not spent correctly will be clawed back and distributed to other states that are doing a better job. And we hope that will stimulate governors to speak to each other, states to collaborate, deal with challenges that historically have been allowed to continue, and in that way improve the quality of care in rural health care. So 5 years from now, it's financially viable. And I'll again remind you, the most expensive care is bad care. Because if you're getting bad care, you're paying for someone to do the wrong thing, then you're paying someone to fix the wrong thing, and you're paying for the complications. And we believe this fund will help provide high-quality care for Americans living in rural parts of the country so that it'll also be more financially affordable. Thank you.
Questions for Dr. Oz?
Yes, ma'am.
Dr. Oz, how many rural hospitals have you personally visited?
Dozens. This is not in this term. This term, this is a 24/7 job. I have traveled to probably 3 or 4 rural hospitals, but I've not seen the numbers of hospitals in this term as I've seen in my career. But as a heart surgeon, but also someone who is honored to be invited to a lot of hospitals, both to give talks but also participate in some of their grand rounds, I've seen my share of hospitals. And the smaller institutions are the ones that I'm worried about.
Dr. Oz, is it a problem if that ACA funding, that enhanced subsidy, is not extended by November 1st to open enrollment, given that insurers will have to lock the rates in? Can those people be helped after that?
There's a lot of discussion right now around how to make the ACA work best for the American people. I think the CR should be clean, as the leader was speaking, and allow that process to continue. But rest assured, there's a lot of discussion on this topic daily. It's the topic that I personally think about the most. Yes, ma'am.
As a physician, as a doctor, Florida, for example, told their mandate that children be vaccinated in order to attend public schools. Is that the right call? What should parents be doing?
Well, one thing you can be sure of is that parents love their kids more than anybody else loves their kids. And so I think part of the challenge of vaccination is to make sure that we understand what's out there, what the opportunities are, but continue to kick the tires and double check like a loving parent does. I don't think we should mandate what parents do with their kids, but we should make those vaccines available. That's what I intend to do with CMS. So we are giving vaccines, obviously, to all seniors without any restrictions at all, and we will pay for children who desire vaccinations as well continually, and that has not changed whatsoever. There was one other question here, I think, but now you get the big question.
Yeah. You just said a moment ago that hopefully Democrats deliver the votes. That implies that they should have been part of this negotiation. Speaker Johnson put out a CR without anything there. How can you possibly ask them to deliver the votes, admitting that you need the votes, without involving them in the discussion?
Well, they are a part of the negotiation. They have been.
They say something very different.
Ask the ranking Democrat on the Senate Appropriations Committee if she's been talking to Senator Collins, the chair of the Appropriations Committee, and their counterparts in the House. This is regular order, Chad. I know it's a different process than what everybody's accustomed to around here under Senator Schumer, but we are allowing the appropriations process to work. And so the bill that we're going to be considering is something that, as I said, is clean, is something that the Democrats in the past have endorsed 13 times when Schumer was the majority leader and Biden was in the White House. 96% of the Democrats voted for all 13 of those. This is again, a new practice that's been invented because of Trump derangement syndrome and because these Democrats hate giving this president a victory on anything.
But you didn't negotiate.
It's what's to negotiate. It's a clean CR. It is a clean CR.
But what if that's
they have had the opportunity to negotiate. There are anomalies in there that the Democrats wanted in there. We are doing this the way that used to be done, and that is allowing the Appropriations Committee and the respective chairs and ranking members to do this the right way. I know it's a new concept. Yeah.
In the wake of the Charlie Kirk assassination, there has been a lot of discussion about what constitutes free speech. I'm wondering, where should that legal line be drawn, and what role does the federal government have in going after free speech?
Well, I mean, I think my own view on this, and my colleagues can speak for themselves, but this is a country that cherishes free speech, and we need to continue that great tradition. It's part of our heritage. But that does not include the freedom to conspire to commit violence. And I think that is where, obviously, the lines have to be drawn.
Leader, given the political peril in voting for the shutdown, how do you gauge the amount of support you'll have on the Democratic side?
Well, I mean, it's going to be up to them. And to Chad's earlier question, it's not like I said this earlier. They seem like they're kind of having this meltdown over the fact that we're not talking to them. Well, we are talking to them through the right channels, and my office is right here. Chuck's is right here. It's very easy for him to come to here, or to say we need to have a conversation about this CR, which is clean and has anomalies that benefit Democrats as well as Republicans, something that 13 times when they had the majority, 96% of Democrats voted for. So this is where we are right now, and I'm hopeful that they will, again, to me, come to their senses, and there will be some Democrats at least who will give us the 60 votes that are necessary to keep the government open. They want this political fight because they think they're politically advantaged by it. I don't think the American people are going to believe if the House Republicans move a CR, short-term CR that's clean, and every Senate Republican is prepared to vote for it and the President's prepared to sign it, that they're going to believe that it's the Republicans that are stopping this. It's clearly going to be on the Democrats because of this is a practice that has been repeated multiple times, and most recently by the Democrats when they had the majority. One more.
Leader, you said this morning that CR is not the place for the ACA fix. Well, you said it will be addressed if there's more time to do so later this year. What do you think is going to be addressed? What do you envision?
Well, I mean, and I think Dr. Oz alluded to that. There are conversations around this. Now, these changes were made, and this deadline was put in place by Democrats, both in the ARPA bill and the IRA bill. Those were both enhancements of this program. But it's also a program that is like most government programs, and particularly this one is, I think, especially ripe for some fraud, some waste, and some abuse. So when you heard Dr. Oz talk about reforms, I think there are things that we can do to make the program more efficient and ensure that the American people who benefit from it continue to benefit from it. But it was dramatically expanded under the last majority, Democrat majority in the Congress, and President Biden in the White House. And so now the expiration date is coming at the end of the year. But if we have a clean CR, gives us some time to do appropriation bills. Also allows some time to take a look at and see what the options are for addressing that issue as well.